Today I'm here with Dr. Bothma and we're talking about skin checks and the importance of getting your skin checked and looking for signs of melanomas. You prefer to be called Daniel?
That works for me.
That works. Okay, thank you, Daniel. So for those who might not know, what exactly is a melanoma?
So a melanoma is a malignancy, so a cancer-like change that occurs in the color-producing cells in your skin that we call melanocytes. So when you go in the sun, you start getting a little bit of color. That color is produced by those melanocytes. And obviously we know that they are sometimes clumped together in what we call a mole, but they're actually also distributed all over your entire skin, even inside your eyes. We have some inside our mouth.
Wow.
Inside the first little part of our nose. So they are widely distributed, and interesting is their origin is actually neurological. So they're from the same tissue that your brain develops from. And so the type of malignancy you get from a melanoma is therefore not a cancer, but a noma, same as brain tumors, sarcomas, melanomas, neurofibromas. So that's the type of cancer it is, or malignancy it is.
Wow, thank you. That was a really good explanation. And I'm definitely learning stuff from you as well. Can you tell us why early detection is such an important part for when it comes to detecting melanoma?
Yeah, well, that's a very important question. So early melanomas, what we would call melanoma in situ, or stage 1, some people refer to it as level 1, melanomas are surgically treated, excision, and that's really the end of it. The 5-year survival of a melanoma in situ is over 99%. And in fact, even a stage 1 melanoma, which is an early invasive melanoma, we would expect about a 96% melanoma. But melanoma's danger is that the deeper it invades into the skin, the more the probability, so the likelihood of it spreading to distant places. And in fact, every 1 millimeter is associated with about a 10 to 15% loss of life at 5 years. So it's a very dangerous type of malignancy. So early finding it, a simple surgery. Late finding it, it's going to definitely affect your life, maybe even shorten your life considerably.
Yeah, wow. It's very important to find that early then.
Absolutely, yes. And we have so much great technology these days to find it. We've got technologies like total body photography and mole mapping and dermoscopy and widely available.
Yeah, so why not make use of that, right?
Exactly.
Yeah.
Exactly.
Can you tell us, you just mentioned about stage 1 melanomas. Is it easy to be able to identify what that looks like for someone, or does it change?
In all of the years I've done this, I don't think I've ever seen 2 melanomas that look exactly the same. So the real key is, if you're worried about a melanoma, or in fact if you get your moles checked, is to make sure that you get your mole checked by an expert, someone that really knows the subtle early signs of deviation. So really, people like myself, when we examine your skin, we're not trying to find a melanoma. We're trying to find the subtle deviations from the normal that tell us this could be something else.
Yeah.
And then we do further investigations in this. If you wait for someone to be able to clearly say, ooh, that's a definite melanoma, frequently that's quite late in the piece. It's not too late, but it is definitely later in the piece. So seeing an expert that knows what they're doing, and there are many accredited skin cancer doctors, obviously, on the Sunshine Coast. They can evaluate you. They can say, look, you probably need a biopsy, or at least a monitoring follow-up examination. And that keeps you safe.
Yeah, perfect. Can you tell us if there are some common misconceptions that people might have about the lot? You just said you've never seen really any 2 melanoma look the same. Are there misconceptions about what people think, they should look like this, or it will look like a certain way?
Yeah, absolutely. Another great question. So one of the 2 most common misconceptions I see, one is people think darkness equals badness. So if the darker my spot is, that must be very risky. And that's actually not true at all. The most dangerous melanoma is a melanoma we call nodular melanoma. It's pink. And people forget that pink is also a color.
Yeah.
So if you have a pink spot on your body, you should have that checked equally. The second misconception I see quite frequently is people think that I had a basal cell cancer, and then they'll ask me, what's the risk of this becoming a melanoma? And the reality is the origin cell determines the type of cancer. So although a basal cell cancer might want to identify as a melanoma. That's not possible.
Yeah.
So it remains a basal cell cancer. Squamous cell cancers remain squamous cell cancers.
Okay.
And melanomas are always melanomas.
Okay. Maybe that's reassuring for me with the basal cell.
Yeah, absolutely. I think anyone who's had a cancer. But what is the risk? So the key thing here is if you've had a skin cancer, and that means that you've had a radiation injury or perhaps a series of radiation injuries, the real risk is, okay, if I've had these other skin cancers, I'm probably more at risk for melanoma.
Gotcha.
And that means it's even more important to get those regular skin checks. And perhaps some of our more advanced screening tests that we have now available as well.
Awesome. You just mentioned regular skin checks. So what does a regular skin check look like? How often should people going?
I think if we stop with what the Melanoma Institute and the Skin Cancer College and Foundation and all of those say, they probably say every Australian should get a skin check every year of their life.
Yep.
I'm a bit more pragmatic in that I think that as we age, the risk escalates.
Yeah.
And so around 50, 1 in 2 Australians will have had a skin cancer. So certainly at 50 and perhaps the 10 years leading up to 50. So from about 40 onwards, I'd like to see all my patients get a skin check every year.
Yeah.
In the 20s, I tend to be a little bit more flexible and I say every 2 to 3 years, but I try and arm my patients with a good self-evaluating system as well, so that if they see something that they're worried about, that they don't think, oh, I can wait 2 or 3 years, but they get that checked.
Yeah.
And then as we go into the 30s, and this is for someone who doesn't have a family or personal risk of skin cancer, I say every 2 years is fine. But 40 is probably that moment where you say, this is a watershed moment, this is where I start getting this every year.
Really regularly. Yeah.
Now, for people that have had skin cancer, it's quite different. People that have a high risk for melanoma, very fair skin, Irish, light skin, for them we'd probably say annual skin check probably from about 30 onwards.
Yeah.
And then if you've had a skin cancer, the first year or so after a skin cancer, we normally actually want to see you every 6 months.
Wow. Okay.
Because you're in that season of abnormality, that season of presentation. That's when you should have high vigilance.
Yeah.
And then once you've passed that surveillance period, then we say look back to once a year. Some patients prefer to continue with 6 monthly, but we say we'd be comfortable with once a year.
Yeah.
And then, as I said, there's those people with really high risk for melanoma. For them, we'd probably also say more regular.
Yeah.
But the minimum from 40 onward should be once a year.
Yeah. You just mentioned about arming your patients with tools that they can identify and be checking their own skin. What sort of things do you get them to be looking for?
So I think many people are familiar with the old ABCDE rule, you know.
Which we've spoken about recently.
Yeah, and so I think the problem with the ABCDE rule is it's very limited, and in fact it's very much geared towards late stage things, because you're looking for, and plus it actually assumes a level of deep knowledge in the average person out there to look at this weird little spot going, I don't know. So around 10 years ago, there was a study done that found that there is I think a better test, and it's called the ugly duckling sign. So the ugly duckling sign simply states you see a spot on your hand or anywhere on your body, and you just think it looks different. So remember, the ugly duckling wasn't ugly. It was a swan. It looked different than the ducks. So if you see a spot that you think that just looks different, then the goal would be either one, I think this looks really different, I'm going to phone, I'm going to get an appointment, or take a mole, which is what I call a selfie of a mole, a nice in good focus photo, and then 3 months later, take another photo.
Yes.
So studies have shown that if it is a melanoma, 95% of melanomas show clear signs of change within 90 days.
Wow.
So 3 months. So you will probably see something that's changing. And the adverse of that is that 98% of spots that didn't change within that 90 days were found to be normal.
Great.
So that's a very sensitive and a very specific rule. And in fact, the ugly duckling rule is 85% sensitive. So it means, 85% of the time you think that just looks different. You're going to be right. And it's 83% specific. Means that 83% of times when people come in and say, Doc, I just think this looks different. They were right. And it was a melanoma.
Wow.
So That's, I think, a very simple.
Yeah.
It doesn't mean that you have to know the asymmetry and the border and, if it's elevated or not.
Yeah.
You're just like, that looks different.
It's different. Yeah.
I've got to take
Just
a look
call it
at
what it is.
Yeah, that's it.
Brilliant. Thank you. Can you talk us through, so someone that's never had a skin check before, what can they expect when they do come in for a first skin check?
Yeah, so firstly, that depends from a little bit from clinic to clinic. But if we talk about what we do, so we have really two levels of skin check. Or someone who just wants a spot check, I always counsel people to don't just have a spot check. The vast majority of people that I found a cancer on, who came for a spot check, it was a different spot than the one they were worried about. Wow. So I always try to encourage people to get the full check while you're here, right? But so we have two levels. We have the standard skin check, which involves disrobing. So one of the key things, obviously, about our that's different from other specialties is we need to see your skin. So we tend to not give you a robe. We need to see your skin. But we have many ways, chaperones and partial disrobing. So we make it so that you can be comfortable. That's really important, that you're comfortable in the check. But we're going to look at your skin from the soles of your feet to the top of your head. We're going to look at that with our eyes. I tend to actually use some binoculars. We call them loops. So I can really have a heightened awareness of your skin. And then we will also use something called a dermatoscope or dermoscope, which is a microscope that we use to evaluate the colored spots, specifically the colored spots on your skin. There's two types of that. There's the standard one, handheld one. We're a bit more sophisticated here. We use a wireless one.
Okay.
So it just means I can put it on a TV screen. And again, I can then show my patients that, look, this is what I'm worried about.
Yeah.
I find it's a really good communicating tool.
Yeah.
And then we have what's called a comprehensive skin check, which takes a bit longer, because we've introduced a technology called total body photography, which is a new, they're actually currently doing a very big study in Australia called the ASMIT study, to see if that's really valuable for melanoma detection, similar to what mammograms are for breast cancer.
Yeah.
But they haven't quite convinced Medicare yet.
Okay.
But that's the goal. So someone who comes in who, for instance, says, well, look, I've had a melanoma, or everyone in my family has had a melanoma, or I'm Irish, I've got really fair skin, I'm very freckled. We encourage them to say, look, booking for that comprehensive takes about 20 minutes longer, but you have the total body photography. That gives us a point in time of your skin, but also allows us to use the new kid on the block, AI.
Yeah.
And so we use AI to actually evaluate and give us some prognostic and diagnostic support in thinking someone is abnormal. So the bare minimum is we would have a look at all of your skin with a microscope and our eyes. And then the more comprehensive, we add that total body photography. That's as simple as it is. A skin check. Some places will do it faster, but I like to be, very thorough. Yeah. So it'll probably take about 20 minutes.
Okay.
And that allows us time to talk a little bit about things like prevention, sunscreens. The TGA has come out with a whole bunch of things about sunscreens recently.
Yes.
And we may even talk about supplements that help reduce your risk. And if I have to do something like an examination, like a biopsy, for instance, it allows us time for all of those things.
Yeah. Obviously, you touched on other ways to prevent and measures that people can take, whether it's sunscreen. What other things do you tell people?
Yeah, so in the general context, obviously, we would say sunscreen, and I would say I'm not talking about all sunscreen. Mineral-based, specifically zinc sunscreen, has been shown in a large study, in fact, done very close to us in Namibia, 15-year-long study, a very, very long name, so I'm not going to put it out here. But that study is the only study that really found that sunscreen, specifically zinc sunscreen, had a phenomenal effect on decreasing your risk for sunscreen. So, so it's called, I'll have to get the study name, I guess. Yeah. It's called the Namibia Skin Cancer Prevention Trial through the daily application of mineral sunscreen.
Wonderful. That's right, we'll have captions.
Yeah, it is a long, and it doesn't have an acronym, which it should really have. But what they found there was that the population in the sunscreen trial, so they applied sunscreen every day, regardless of the weather, regardless of whether they were going to the beach. In that study group, they had 50% fewer moles. Wow. And therefore 50% fewer melanomas. And they also had 70% fewer non-melanoma skin cancers of the squamous cell type. So 70% fewer squamous cell cancers. Didn't really affect basal cell cancers.
Okay.
And then here's the real seller, is that the people that were in the study after 10 years, when photographs of them were shown to a panel of of independent dermatologists, they look 10 years younger than the group of people that didn't use sunscreen daily. So sunscreen, and I think maybe it's because zinc has a real therapeutic benefit for your skin as well. They look better, younger. So sunscreen has benefits beyond
just blocking
out the sun.
Yeah.
And frequently when I speak to my younger patients, I try and use that maybe to encourage them. They may think I'm never going to get a skin cancer, but if I say, but you're going to look 10 years younger, that's a seller, you know. That's so you got to use things like that. So that's the sunscreen thing. But I always do try and tell people that the key thing to understand about sunscreen is a risk reduction strategy.
Yeah.
You still have risk.
Yeah.
You just have less risk. So more and more we're trying to focus on what's called the sun harm avoidance strategies. Wearing a hat, wearing a shirt. You know, there's a company called Nashi. They're trying to promote these normal shirts that look like rash shirts all the time.
Yeah.
I was actually going to wear my Nashi today.
Oh, you should.
Oh gosh. And obviously, you know, umbrellas and there's a company in Brisbane called SP Arms that make these very good UV protective sleeves. So I think there's a lot of new and evolving ways to help people prevent. Then beyond that, there's systemic things like supplements. Niacinamide has been shown in 2 studies, an Australian study in 2015, found that basal cell and squamous cell cancer risks were reduced by about 23% if you start taking niacinamide every day. And it was a bit of a small study. So the Americans, doing things in an American way, they upsized it to about 34,000 people, and they found the same results. So niacinamide is the best way to prevent non-melanoma skin cancers by just an oral supplement every day.
Okay.
In fact, if you start taking niacinamide after your first basal cell or squamous cell cancer, it'll actually give you a 54% lower risk to get another one.
Sounds like something I need to start taking.
But also retinol. So vitamin A. We know vitamin A is good for your skin. It does repair in your skin, health for acne and all sorts of other things. But that has a 25% risk reduction for squamous cell cancer. And probably a 20%. So we're talking about melanoma at the moment. So it gives you about a 20% lower risk to get a melanoma. So taking retinol, and maybe taking some niacinamide at the same time, you can actually really do a lot of prevention beyond, I'm going to slap on some sunscreen and wear a hat. Zinc has been found to have a profound effect on risk reduction. So more and more and more, we're finding that there are ways beyond just the standard, stuff, the slip and slap stuff, to probably push that risk reduction even further. So there's a lot of evolving things happening.
That's fantastic. Thank you. Should we be doing obviously all the preventative things, but should we be looking out for particular things on our children? Is there an age where we start to worry a little bit, or is it more about the exposure to the sun?
Big topic. So I think let's start by understanding one reality about how we grow. So how do we go from this high to this high to this high in terms of our skin? And that's by cloning. So your skin that you're born with, divides as you grow. And so the key thing is, if you were to get really badly sunburned as a very young individual, it is that very badly sun-damaged skin of yours that gets copied. And so you can unfortunately end up at a young age with really severely sun damage because you were not protected when you were young. So I think as parents, we have an incredible responsibility when we live in this beautiful country to take that step of how do I protect my children. And this is now one thing where I really think sunscreen doesn't cut it.
Yeah.
Because you always have to remember that sunscreen gives you a time benefit, right? So it reduces your risk for an hour, maybe 2 hours, but then you will start to get burned. And so, someone who plays cricket or tennis or netball, they're out there for longer periods. So I think one of the best things we can do, number one, is we can model what it looks like to be sun smart. So big hats, sitting under the umbrella at the beach, not going to the beach maybe middle of the day, but let's go early. Let's go into shoulder times, late in the afternoon, when there's a nice breeze blowing anyway, it's probably more comfortable. We can do things like we can put sail protection over our pool so our kids can swim comfortably but protected.
Yeah.
And then if you have really good or really small children, I recommend the kind of onesie approach uh, to sun shirts and stuff, right? So you can get really good full body suits that you can put your little kids and your little babies in, and as they grow, the really nice long board shorts, or if the girls also the longer proper cozies, maybe not quick to rush into bikinis, but and you have 15 years, in my experience, that you have that influence, because by about 15, your children start saying, man, my friends on TikTok or Snapchat, or they've got something else going, and I'm going to go with that. The number of conversations I had with my own kids where I would say, no, you're not going to the beach at 1:00, regardless of what your friends were saying. And I feel a bit, I achieved something because my daughter's whole group started not going to the beach.
She influenced them. Great.
Because she was a little bit of a leader in the group, and I just put my foot down. I just said, no, I'm happy to drive you guys here up and fetch you, but not at that time.
Brilliant.
And the same with my boys. I really taught them that the way you go to the beach is you wear a long sleeve rash vest. So I think that's what we should do for our kids, as long as we have influence, is protect them by dressing them appropriately. Taking them to the beach at the times that we know is safe, and that's really how you're going to make a difference for the future. I see so many Australians that are now in their advanced years who have terribly sun damaged skin, because in their youth it was like you've got to bake your skin to make it tough and stuff. So that's really not the goal that we should be going for.
No, I spoke to a gentleman the other day for National Skin Check Day, who told me in their era of growing up, they would put on baby oil and olive oil and cook themselves at the beach.
Look, it's a fundamental shift. When I was a teenager, we didn't use sunscreen. It was called sun tanning lotion. So the idea of putting that stuff on your body, mostly Tropicana coconut oil, so that you could really fry like an egg out there, was to make you tan quicker, more effectively. It had nothing to do with protection. It was only about 20 years after that that there really started being a shift to, look, actually, we should use the stuff for protection, not to get the burn, right? And I think this generation is sort of the first one where we have the biggest possibility to have a huge impact.
I think so. I think, unfortunately, there are still, like you're mentioning, the influences of TikTok and trends on social media where young people are promoting tan lines and saying that's a very aesthetic look. And I think there's, definitely a big shift that needs to come to influence them in the other direction and say tan lines aren't attractive.
That's true.
Yeah.
I'll tell you, it's a little bit off to the left of field, but an interesting history of tanning. So, if you know that the Western population, after the Industrial Revolution, spent most of their time indoors, in factories, in the mines. And so in the 80s, with the yuppie generation, that was the first generation that actually had recreational time. The best way to show your friends and relatives that you had time for yourself was to come on a Monday to say, look, man, I've got a bit of a tan. I had time. I could slide at the pool, right? And so for us in the Western world, having a tan is a status symbol of I have time for me time. Right?
I've been relaxing. I've been outside.
And so because we came out of the factories and out of the office blocks to have some time in the sun. Now, the interesting thing in the Asian world, this is exactly the opposite, because for them to have fair skin means, like the geisha, like the high-level nobles, you were able to sit under the shade porch while you watched all the workers in the rice paddies getting really tanned. And in fact, I have a friend in Sydney who's originally from Japan. She says her parents never wanted to come back and visit in their winter, because she'll come from our summer, because she's too tanned. And they say, look, we sent you to Australia to have this better life, and now you look like you work in the rice paddies. it's humiliating.
I get it.
So
Yeah,
it's,
culturally, they're like...
yeah, and if you've
that's
ever
not-
seen a
yeah.
bus of Asian tourists, you'll notice they have umbrellas.
Yeah.
They wear gloves.
Yeah.
They are very religious almost about protecting their skin. And it's not ironic, because at the moment we see there's this big influence of the Korean product and stuff. So clearly people aspire to that look.
Yeah.
And sometimes we need to maybe buy into that. Say, look, why do they look so good? Because they protect their skin.
Yeah.
Yeah. That's really, I think, a message that we're still not getting is where we still think time at the beach equals time I have for myself.
Yeah. Okay, I think we're going to wrap it up. So if someone's watching this and they've maybe never had a skin check, or they feel maybe I do have an ugly duckling, what are you encouraging them to do?
Well, if you've got an ugly duckling, or if you have a spot that you're worried about, a wound on your skin that hasn't healed for over 3 months, or, if you work outside or you spend a lot of recreational time outside, I think that I would encourage you to go and get a skin cancer check by an accredited skin cancer doctor. And that's kind of an important message. Is there are many people that say they have a passion for skin and they love skin, but there are also doctors who've invested time and energy and have become certified. They've gone through postgraduate training, so they can truly help you. And I think that we all owe it to ourselves to look after ourselves to the best of our ability. And that also means selecting the right support team, the right healthcare team to help you with this. I think if you've got an ugly duckling, phone and have an appointment. It's such a non-confrontational type of examination. You don't have to lie in a narrow tunnel. You don't have to take your piercings out. We don't mind if you're tattooed. All comers, all shapes and sizes. We like to examine and make people safer.
Yeah, perfect. Excellent. Well, I think we're going to wrap it up there. Thank you so much for your time today. I think I certainly learned a lot. I thought I knew a bit, but there's so much more to it than we really
realized. What if I know nothing else, but this is what I know?
Yeah.